Hi, my name is Stephanie Casella, and I chose to research heterotopic ossification. Heterotopic ossification, for those of you that may not know, is a disease where bone grows in areas that are non-skeletal, such as muscle, tendon, and other soft tissues. Due to the fact that this disease is not very well known, I wanted to highlight the different prevention methods and treatment options through studies and information on how a patient can best be treated. Although heterotopic ossification is not something you hear every day, it is quite common when it comes to surgeries such as total hip arthroplasty. Its presence varies from about 15 to 90% in patients following a surgery of that kind. It is also a disease that affects males more than females by a ratio of 3 to 2. The exact pathophysiology of heterotopic ossification is still not yet fully understood. However, it has been hypothesized by many that the mesenchymal cells in septum connective tissue are transformed into osteogenic cells. The main causes for heterotopic ossification development include trauma, such as spinal cord injury, central nervous system injury, joint replacements, or related to extreme burns. It is thought that after these traumas, inflammatory cells and downstream signaling events wrongly activate the formation of bone in the non-skeletal site. Symptoms vary between patients. For example, swelling may occur in one, while another patient may experience redness and a decreased range of motion. In cases of severe heterotopic ossification, the rapid bone growth, which is about 3 times the normal rate, can cause extreme pain due to its jagged ends. Radiographs are used to identify heterotopic ossification. In early stages, these radiographs are not as useful to detect the heterotopic bone because it will not yet appear. However, once a low-density mass is detected in a CT scan, and heterotopic ossification is suspected, the final diagnosis cannot be made until another short interval follow-up is made and an additional scan will be needed showing the mass. From there, depending on the severity and the rate of growth, a treatment plan will be developed for the patient in order to manage the disease. There are currently 2 main prevention approaches, which include non-steroidal anti-inflammatory drugs and radiation therapy. However, radiation therapy was found to have the most amount of successful cases. In one study, 14 patients, all suffering from heterotopic ossification, underwent excision surgery and were irradiated at different dosage levels depending on severeness. This study demonstrated just how effective radiation therapy is by leaving all 14 patients who were at high risk of developing heterotopic ossification completely clean of the disease. Not only did the radiation therapy inhibit the heterotopic ossification from returning, but it did it safely to the point that there was no documentation of impaired wound healing or induced toxicity at all. Although prevention of the disease is favored, it is not always possible to avoid the occurrence of heterotopic ossification in all patients. The current treatments include surgery, radiation therapy, physical therapy, and recent studies have shown effectiveness in shock therapy. In a case study of a 46-year-old female, there was reported pain and limited range of motion for about 3 months. After an excisional biopsy, it was revealed that there was heterotopic ossification present. However, there was no history of past trauma in the patient, which indicated idiopathic heterotopic ossification. The ectopic bone was removed once matured, which decreased the chances of reoccurrence, as well as damage to tissue surrounding the area. In addition to that, arthroscopy is quite a minimally invasive procedure, which could potentially pave the way for a shorter rehabilitation time. After extensive research, it was found that radiation therapy proved to be the best preventative method, while surgery was the most successful treatment option. Radiation therapy displayed a great ability to prevent the disease from developing. Not only did it inhibit the disease, but it was able to do so while allowing the patient to fully heal without any complications or levels of toxicity in the process. In addition, surgery is still appearing as a strong suit when treating the developing heterotopic ossification because it is minimally invasive and it could have a shorter rehabilitation time. Overall, I believe that there is still a strong need to do further research into this topic, due to the fact that the pathophysiology is still not yet completely understood. Not only that, but there is no universal treatment for this disease, and it varies with every patient. Because of this, I think it is so important to understand the prevention and treatment methods so that every patient is given the best possible treatment plan to manage the disease. Thank you.